This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
It's the leading cause of death worldwide. In the United States, one person dies every 33 seconds from cardiovascular disease, and a heart attack happens every 40 seconds.
It doesn't really declare itself until it's almost too late.
Cardiovascular disease includes heart disease and stroke. This week, we're talking about who's most at risk and why, and what are some of the steps to take right now to reduce your risk, plus the connection between avocados and your heart. It's all about Heart Healthy Matters straight ahead on this week's edition of Prescription for Life. Thank you so much for joining us. I'm Monica Robbins. Cardiovascular disease is killing millions around the world. Now, the good news? It's preventable. The leading risk factor is high blood pressure, and it's often referred to as the silent killer. Many people aren't even aware they have it. Doctors say you must go looking for the signs.
In the case of heart disease, you want to go looking for trouble. And the way to do that is really to sort of check, your blood pressure, check your blood sugar, get your screening tests, and follow what the American Heart Association calls Life's Essential 8. These are 8 things that if you do, you can dramatically reduce your risk of having heart disease or, ever dying from a heart attack.
Who's most at risk? Well, people of color are at a higher risk for heart disease, and so are women. A Northwestern University study estimates heart disease deaths in 2018 alone accounted for nearly 4 million potential years of life lost. And that figure is 30 to 60% higher for Black men and women. Experts call these findings alarming, considering recent advances in heart disease treatment and management. Brittany Falkers from our Portland station has more.
African Americans are 30% more likely to die from heart disease than non-Hispanic white people. Nearly half of all African American adults have some form of cardiovascular disease, including heart disease and stroke. And social factors play the biggest role in shaping people's health. Things like money and resources, education, quality health care, a safe living environment, and access to nutritious foods. Tanya Adams is the Chief Health Services Officer for Regents and a board member of the American Heart Association.
Many of them fall under the category of socioeconomic, and so if you think about some of the neighborhoods that Black Americans live in, they have sometimes food deserts, don't have access to good health care, that sort of thing, lots of stress from financials, and then sometimes obesity, etc. And you put all of those factors together, it just increases the chance of having some type of heart problem, whether it's stroke, heart attack, etc.
High blood pressure is the leading cause of heart attack and stroke in the U.S. And there's a disproportionate impact on Black women. African American women are nearly 60% more likely to have high blood pressure compared to non-Hispanic white women. Nearly 58% of Black women over 20 years old have high blood pressure, and only around 20% of those women have their blood pressure under control. Cardiovascular disease kills more than 50,000 Black women every year, and stroke is the leading cause of death among Black women.
Know your numbers. And so if you don't have a blood pressure monitoring cuff at home, get one. They're fairly inexpensive, and just know your numbers and monitor it regularly. And so 120/80 is where you want to be. If you start creeping up a little bit to 130, be concerned, take all those precautions, if you will, to make sure that you're maintaining your heart health.
Know your family's history and get to your doctor for those annual visits. And of course, remember, a healthy lifestyle is a big factor in prevention. A nutritious diet and regular exercise.
And then I can't underscore enough, exercise. It's really important that you get out and exercise and help yourself, and then eat right, of course. Do all those things you can to help prevent any heart attacks or other heart problems.
Now to our expert on more ways to spot and reduce the risk of heart disease. Joining me now is Cleveland Clinic cardiologist Dr. Leslie Cho. Thank you so much for being here.
Thank you so much for having me.
Okay, so Cleveland Clinic, they do this every year, but they put together the National Heart Survey each February. What were the results this time?
So this year we wanted to ask about wearables. A lot of people, you're wearing a wearable actually, yeah? And how many of you are wearing wearables? What are you doing with these sort of information? How much do you trust AI in medicine? So the very interesting thing is Americans are extremely enthusiastic about AI in medicine. A lot of people have asked ChatGPT or one of those forums about medical questions, but thankfully 90% of them have also asked their physician, which is good. The other really interesting thing is 50% of people are wearing wearables, and wearing that actually motivates people to exercise more, to walk more, to keep track of their calories, which is really, really interesting.
But a lot of these are now doing, you know, they check your pulse, they do your EKG, they can check for a heart flutter or something.
Yes, yes.
As a cardiologist, does that concern you, or are you actually seeing people come in? My watch told me that, you know, this happened.
So we see both angles. So I mean, there are great examples of patients diagnosing themselves with AFib or SVT, and that's really helpful, like to catch those kind of EKG tracing and show it to us. That's super, super helpful. And then there's obviously the other extreme, which is people are so worried. You know, sometimes they say things like your heart rate's really fast, and then they get really worried. They come and see us. It's always nice to err on the side of caution. You have to sort of let, you know, doctors sort of make a decision. But I think for many people, especially our patients with AFib, that's been really a game changer.
So a lot of people always Google when they, you know, Google their symptoms, but now we have AI, and you talked about that a lot of people are using those forums to ask medical questions. How concerned are you? Because it's still in its infant stages.
Absolutely. I mean, we're very concerned, and I think, you know, thankfully the survey shows that people do ask the questions, but they confirm it with their doctors, which is really, really good news. I think very few patients have used that as an advice that they, you know, embrace. I also think it's really important, you know, a lot of times people Google, and when they Google stuff and they have a response, any answer seems like a legitimate answer, right? Because the American Heart Association, the American College of Cardiology could say something, but so can really anyone else. So I think the best thing to do is to sort of ask your doctor, you know, their opinion. You know, we get a lot of that for medicines. People are very afraid to take medicine. This is a new era. And I really genuinely believe in shared decision making, but I do think that, you know, you have to sort of meet physicians sort of halfway. There are so many things out there now on the internet about side effects of medicine, but what they don't show is the benefit. You know, so you really have to sort of talk to your doctor, tell them your fears, and then let the doctor sort of give their advice, and then come up with a shared decision making on what to take or the tests to move forward with.
So cardiovascular health is still a huge issue. Also problems with it, the #1 killer of both men and women. Yeah. Are you seeing a trend in anything that, you know, especially, you know, with women, let's start there because their symptoms are typically different. Are you seeing anything different, or is it happening to younger women?
Yes.
Or? Really?
Yes, Monica, you're absolutely right. One of the key signs that we really are concerned about is the increase in cardiac disease for younger women. And, you know, most of us think that that is related to diabetes, that has to do with obesity. You know, kids are having type 2 diabetes, which is, you know, tragic. Increase in maternal mortality. You know, maternal mortality is related to cardiac mortality. And of course, increasing in those things raises the risk of having cardiovascular events for women. So that's very concerning. You know, cardiac disease, one of the great things about cardiac disease is that 90% of it is preventable. And, you know, there are steps that we can take as a society, steps we can take as an individual that can really lower your risk.
What are those steps?
So the #1 thing, smoking. Don't smoke. If you stop smoking, you can greatly reduce those risks. You know, really making healthy choices about eating and exercising. Knowing your numbers, like if you have high blood pressure, diabetes, or cholesterol. It's really important to eat right and to exercise. You know, we say that all the time and it sounds so simple. It's really hard. It's so hard. But, you know, there are some really easy things to remember. Plant-based diet. Your diet should be mostly plant. Then comes fish, chicken, and turkey. And then as an accent, meat like, you know, beef, pork, lobster, and shrimp. Complex carbohydrate, really minimizing sugar. Refined flour, that's, you know, not a good thing. And really cutting out things like pop that are, you know, just pure sugar, has no nutrition value. And then exercising. You know, when I say the word exercise, patients automatically like feel like, oh my God, I have to go to a gym, I have to spend a whole bunch of money. But just parking further away, you know, getting off the elevator one floor before and walking up, all these little things, they add up.
Well, I don't think a lot of people realize that you don't have to exercise for an hour at one time.
Yeah.
So, but the other issue is these help because it tells me when I get my heart rate up, it buzzes.
Yeah.
And so I know even if I'm walking the dog and I think I'm walking very fast, I look at my watch and I'm not.
Yeah.
It's a good telltale sign, but explain when you talk about exercise, the importance of getting that heart rate up. For the average person, what should it be?
Yeah, that's a great question. So exercise, you know, we want you to exercise. Cardiovascular, getting your heart rate up is super important. As you age, we think about balance and muscle mass. But in order to get your heart rate up, it should be moderate intensity. So if you and I are walking and I'm able to carry on a conversation like this, I'm not exercising. I'm enjoying myself, but I'm not exercising. I should not be able to say more than 3 words without taking a breath. That kind of moderate intensity. You should be, you know, clipping along. You know, a lot of times we walk and we think that's great, and that is great, but actual cardiovascular exercise means you get your heart rate up and then you slow it down.
And that is great for women too, because it helps with weight loss when you do the HIIT training, if you will. So how long? So if I, you know, I'm on the treadmill and I run very, very slowly just to get my heart rate up for a minute, and then I let it slow down and then I do it again. Is that enough?
Well, so in order to have weight loss, we think about something called, you want to be in moderate intensity for a longer period of time. So 70% of your maximal predicted heart rate, which is kind of getting mathematic, but it's 220 minus your age times 0.7. But you want to do that for a longer period of time. But if you do HIIT, which is fast heart rate, and then you slow down, and you don't really take a long break, and then you go again, and then you slow down. 19 minutes, most people think, that type of exercise can really have a dramatic impact on your heart health. You know, there's a lot of free exercise programs out there. Nobody needs to like spend a lot of money. You can Google it about these short interval training that they can do for weight loss and for cardiovascular fitness.
Everybody can do 19 minutes, is what you're saying.
Yeah.
I want to talk to you about heart attack symptoms that women typically have, because, you know, we can't say this enough, and women often are too busy taking care of everybody else and they don't pay attention to themselves. But those weird symptoms that women need to be aware of.
Absolutely. So most women have similar symptoms as men, which is somebody sitting on their chest. Like you feel chest pressure, chest tightness, chest heaviness. You know, we say chest pain, but it's really not pain. It's like pressure. But 30% of women, as you say, have atypical symptoms. Some people will say they have back pain. Some people will say they have severe nausea, just extreme shortness of breath, jaw pain, left jaw pain, or pain that radiates down their left arm, and they have sweating, diaphoresis or sweating. But if you feel like something doesn't feel right, for God's sake, you know, don't be a doctor, go to the emergency room. One of the tragedies about cardiac disease is that even now in 2024, with all the campaigning that has happened, women still present to the emergency room later than men with their heart attack. So forget like doctors getting the testing later. Women present to the emergency room later than men.
And why do you think that is?
And I think, you know, some of that has to do with the fact that we wish it's not heart disease. Do you know what I mean? Like when something is happening to you, there's that hope phase where you're like, oh, I hope that's not heart.
I must have eaten something weird. Yeah. Or the denial phase.
Yeah. And I think if you feel like something is wrong, the best person to figure that out is not you. It's usually a doctor.
So we're, still in the colder months, and, a lot of people are shoveling snow, and I don't think a lot of people realize, especially if you're at risk, how dangerous that can be.
That is absolutely dangerous. And, people think like shoveling snow, how hard can it be? It's very strenuous exercise. And so if you haven't been exercising and you all of a sudden go out there and drive and snowplow your driveway, you're at an increased risk. We often kid among doctors when it's first snow. Oh, here's, we're going to have a bunch of heart attacks today.
And do you?
We do. We really do.
Oh, wow. So it's like the full moon thing too.
It is.
The emergency room gets busy.
Yeah.
We're also still in the peak of respiratory virus season. Can that impact your heart?
Absolutely. There was a study that came out a couple of years ago where it says that if you have flu, you have an increased risk for having a heart attack 6 to 8-fold. So that's why we want you to get your flu shot, because when you have a flu, and those of you that have had a flu, they know how horrible having a flu is. That kind of whole body response of inflammation can rupture plaques, so cause heart attacks to happen because cholesterol plaques break off and cause, blockages in the artery.
So I'm just going to throw this out there. Coughing could actually cause a heart attack? Or
it's more of the inflammatory response.
Gotcha.
Right.
Okay, so those things on the internet that people see that you can cough and stop a heart attack,
oh my God.
Not true.
Oh my goodness.
Please don't share that. Yeah, please don't share those things.
You know what coughing does do is that probably this is where it started, is when people go into this fast rhythm called SVT, they can cough and stop that rhythm. It's not a heart attack. It's supraventricular tachycardia. So when they're going really fast, we have patients who have SVT. We tell them either bear down or cough, and it stops it.
But it doesn't stop a heart attack.
No, for goodness sake.
Yeah, so there's a big difference between SVT and a heart attack. If you could shake all of your patients and have them follow, be compliant with all of your advice, is there one thing that you wish they would all do?
Besides not smoking, and I mean that for cigarettes as well as for marijuana, because marijuana is really, actually a risk factor. It increases your risk for heart attack. If there's one thing I can tell people is that heart disease is preventable. This is the good news. And it's totally preventable. Whether your family history is bad or not, it's preventable. You can do it with diet and exercise. You can do it with medication, which is a supplement to diet and exercise. And so, in 2024, you can be an active participant to lowering your risk.
If it's preventable, is it reversible?
Oh, Monica, this is a very, very interesting question. So Dr. Nissen, one of our colleagues at the Cleveland Clinic, did a study of looking at putting a television camera down coronary arteries. And what he found is that if your bad cholesterol is less than 55, there is something called plaque regression. That less than 55, so bad cholesterol, L for lousy, bad cholesterol less than 55 can cause plaque regression. LDL less than 70, so bad cholesterol less than 70 causes plaque stabilization, so your plaque stays stable, but less than 55 is regression.
But we see levels typically around 100 or so, right?
Yeah, and we are very aggressive about lowering cholesterol at the clinic. So if you have diabetes, if you've had a heart attack or stroke, we try to get you down to less than 55.
How do you do that if somebody, you talked about medication, and a lot of people are looking at side effects. How do you lower your cholesterol without medication?
So about 15% of the population are hyperabsorbers of cholesterol from their small intestine. So that means 85% of us are not, but the 15% are. And for those people, if they go hardcore vegan, so nothing that comes from an animal, absolutely nothing, they can lower their cholesterol significantly. Not many of them can lower it to less than 55. So you do need medicine. There are some really great medicines out there. I know people have lots of concerns about statins. Statins have been around since the 1980s. 1980s, incredibly safe, has been tested in over 1 million people, really profoundly good benefit. Penicillin was approved based on 40 patients. Yeah. And people are willing to take every type of antibiotics, but they're not willing to take statins, which I think is interesting and speaks to the modern time. But with medications and with diet and exercise, in combination, you can get people's LDL down to 20 and 30.
I see a lot of times that people are so desperate to get off medication for a variety of reasons, but
Yes.
Is it possible once you get your LDL down and if you have hypertension and you get your blood pressure leveled, can you drop those medications?
I mean, I think if you were to lose, like, let's say you got high cholesterol and high blood pressure because you were overweight and you lost a lot of weight, then perhaps you can come off of medication. It's very hard as we get older because our body makes cholesterol, your blood vessels become very stiff, to completely come off of medications. When patients want to come off of medication, I totally understand because I don't want to take medicines either. But I ask them, what's our goal? What is our goal? Is our goal medication, or is our goal not to have a heart attack, not to have a stroke, not to have vascular dementia? We have to fixate on the goal and not the other thing, which is medication. If the goal is to live a long time, have a high quality of life, and not have a heart attack or stroke or bypass or stent, then it's okay to take medicine. If our goal is to just get off of medications, are we willing to accept all the, outcome?
Well, isn't it also the medication that is getting your numbers to where they need to be?
Yeah.
So that's a great point. All right, final thoughts. What would you like to leave people with?
Well, I think that, as I said before, heart disease is preventable. You can really become an active participant in changing the course of your health. Diet and exercise is the key, and then medication as substitute. Doctors are there to, help and guide. Using wearables to motivate you, and all of those things are great if you need, but there are really great and free things you can do to get your heart in great condition.
Great advice, great insight. Dr. Cho, thank you so much.
Thank you for having me.
Before we go, you may want to consider adding avocados to your smoothies. Harvard researchers found that participants who ate at least 2 servings of avocados a week had a 16% lower risk of cardiovascular disease and a 21% lower risk of coronary heart disease. That's compared to those who rarely ate avocados. Now, avocados contain several components that contribute to good cardiovascular health, such as dietary fiber and unsaturated fats. Well, that'll do it for this edition of Prescription for Life. Thank you so much for watching. We'll be back here next week with another dose. And until then, I'm Monica Robbins, wishing you and yours good health. Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.